Last class we start adrenergic agonist, valid done with neurotransmitter senses and different drug action at the synapse of sympathetic system. Now we classify these drugs into different categories. Okay, drug directly working on alpha 1 receptor, drug working on alpha 2. For alpha 1 we having phenylphrin, oxymetazoline. For alpha 2, alpha methyl dopa, clonidine. For the function of alpha 1 receptor, alpha 1 causing vasoconstriction, the location present on skin vessel and the vessel of abdominal viscera. So when these drugs causing vasoconstriction, increasing resistance, the resistance increase according blood pressure equation, the blood pressure will increase. So the alpha 1 drug can increase blood pressure. Okay, so we're having two drugs here, phenylphrin, oxymetazoline. Okay, phenylphrin and oxymetazoline. This drug we can use hypo for hypotension. These two drugs also having the eye use in case of red eye. If any inflammation inside the eye, inflammation lead to vasodilation. So vasodilation causing redness in red eye. We're having drop of phenylphrin, eye use phenylphrin. Phenylphrin causing because alpha 1 receptor. Okay, so alpha 1 receptor causing vasoconstriction. So any pathological process inside the eye lead to vasodilation because causing vasoconstriction, so redness. You can treat the red eye by using phenylphrin. Okay. Another use of alpha 1 agonist, phenylphrin, we also can use for internal eye exam. Why? Because alpha 1 receptor causing what with people? Alpha 1 receptor was present on iris. M3 receptor belongs to cholinergic system. M3 causing, it's a parasympathetic system. M3 receptor causing meiosis, constriction of people. Okay? The alpha 1 receptor present on radial muscle of iris to lead to mydriasis, the dilation of pupil. For internal structure of, for examination internal structure of eye, we need dilation. Okay, so phenylphrin causing mydriasis. Another drug used for eye exam belongs to cholinergic system, tropicamide. Tropicamide. Tropicamide is an anticholinergic drug. So what is the difference between mydriasis produced by phenylphrin and tropicamide? Tropicamide block M3 receptor. M3 receptor also present on ciliary muscles, and the M3 receptor also present on iris. Anticholinergic drug also interfere with the lens. Okay, the one property of tropicamide in eye causing what? One, dilation, mydriasis. Another thing, cycloplegia. Cyclo is the paralysis of lens. Lens not able to change diameter because ciliary muscle paralyzed. Clear? Phenylphrine only causing mydriasis, but tropicamide causing mydriasis also. In addition to mydriasis, lens paralysis, lens the accommodation reflex finish. Understand the difference between anticholinergic and adrenergic agonist mydriasis. If the mydriasis is causing by phenylphrine only causing mydriasis, have no interaction with the lens, okay? Because alpha 1 receptor only present on iris, have no concern with the ciliary muscles. Done? Beta 1 receptor present on ciliary body, not on muscle, okay? The ciliary body produce echosymbol. That's the beta 1 receptor, not alpha 1. So in eye, what the effect of phenylphrine? Phenylphrine in eye used to treat red eye. Also can use for internal eye examination, okay, ophthalmic exam. Phenylphrine causing vasoconstriction. If the blood pressure a bit low, you can use for hypotension. Number one use for blood pressure, hypotension. Second use for red eye. Third use for eye examination, okay. Number 4, in case of rhinitis. Rhinitis lead to nasal congestion. Nasal congestion. Inflammation of turbinate inside the nose lead to nasal congestion. So the inflammation lead to vasodilation. Because of the vasodilation, turbinate swollen. So that's why it lead to nasal congestion. Snuffy nose. So we can use phenylphrine and oxymetazoline. Also alpha 1. Oxymetazoline, phenylphrine drops. For what purpose? For nasal congestion, okay? For nasal congestion. So these two drugs causing what? Vasoconstriction. In rhinitis, vasodilation of turbinate swollen because of a lot of blood there. Okay? In nasal congestion, we can apply these two drugs. Okay? Alpha 1, phenylphrine, and oxymetazoline. The uses of these two drugs done. Phenylphrine, oxymetazoline. So now come to alpha 2 receptor. Alpha 2 receptor. What the location of alpha 2 receptor? Function of alpha 2 receptor. Alpha 2 receptor present on presynaptic. Where? Presynaptic membrane. Clear? The function to decrease north epinephrine. Done. It means alpha 2 receptor decrease sympathetic activity. The alpha 2 receptor decrease norepinephrine. Done. Alpha 2 receptor decrease norepinephrine because alpha 2 receptor is attached with GI protein. It's an inhibitory receptor. Alpha 2 receptor, inhibitory receptor, the negative feedback system. The negative feedback system, it lead to decrease norepinephrine. Clear? Decrease norepinephrine. We have two drugs working on alpha 2 receptor, alpha 2 agonist, direct acting alpha 2, okay? Because these drugs directly attach with their receptor. That's why direct acting. Direct acting alpha 2 agonist, number one, clonidine. Number two, alpha methyl dopa. Alpha methyl dopa, okay? So these two drugs, clonidine and alpha methyl dopa, these two drugs, alpha 2 agonist, alpha 2 agonist. So if you stimulate the alpha 2 receptor, if we stimulate alpha 2 receptor, because alpha 2 receptor is an inhibitory receptor GI protein here. So alpha 2 receptor doing what? Alpha 2 receptor decrease release of norepinephrine. Decrease release of norepinephrine. Done. Norepinephrine working on alpha 1 receptor causing what? Vasoconstriction. Norepinephrine working on alpha 1 causing vasoconstriction. So because of vasoconstriction, blood pressure going up. Clear? So the clonidine, if you stimulate alpha 2, because it's an inhibitory receptor, what happens with norepinephrine? Norepinephrine decrease, yeah? So can it cause now vasoconstriction with the help of alpha 1? Of course not, yeah? Decrease activity of norepinephrine. So this drug we can apply for hypertension. Clonidine and alpha methyl dopa. Also used in case of emergency hypertension. Emergency hypertension. To decrease blood pressure, we can apply clonidine and alpha methyl dopa. Another thing, important thing about alpha methyl dopa is not just working on peripheral system. Alpha methyl dopa enter to brain is a centrally acting drug. Centrally acting drug. It also decrease the activity of norepinephrine inside the brain, okay? Decrease sympathetic activity inside the brain stem. Done? The centrally acting drug. So one property of alpha methyl dopa. Another thing is very special, is used in case of pregnancy. It's a very safe drug. In case of pregnancy induced hypertension, or patient having already before pregnancy having hypertension or hypertension due to pregnancy. Clear? In pregnancy induced hypertension, the mother having blood pressure, high blood pressure, the alpha methyl dopa is very safe drug. Must keep in mind, okay? There are only few drugs we can use in pregnancy for hypertension. This is one of them, okay? Alpha methyl dopa used for high blood pressure in pregnancy. Must keep in mind, okay? To treat blood pressure in pregnancy, alpha methyl dopa. Clear? The alpha methyl dopa, the third thing, is very important side effect. Very important side effect. autoimmune hemolytic anemia. Autoimmune hemolytic anemia. These thing only belongs to alpha methyl dopa. Must keep in mind, okay? It's a centrally acting drug used in blood pressure in case of pregnancy. The side effect, autoimmune hemolytic anemia. Autoimmune hemolytic anemia. Alpha methyl dopa induce SLE side effect. Another side effect, okay? The SL is causing SLE. Only 4 or 5 drugs in full pharmacology causing SLE. It's one of them. Clear? Alpha methyl dopa causing SLE, hypersensitivity, the autoimmune hemolytic anemia. Okay. So how this alpha methyl dopa or clonidine decrease blood pressure? How? It's a synapse. Alpha 2 receptor present on presynaptic membrane. Yeah. So the clonidine and alpha methyl dopa, clonidine and alpha methyl dopa. These two drugs doing what? They stimulate this receptor. Yeah. Because these are agonists. They stimulate these. This is the only exception in this, in all these group, only exception. All other drugs, epinephrine, norepinephrine, dopamine, we use for if patient having low blood pressure, phenylphine, oxymetazoline, patient having low blood pressure, yeah, patient having hypertension. The only exception, these are the sympathetic agonists, but these drugs used for high blood pressure. Understand or not? Okay. Because they have interaction with the alpha 2 receptor. Alpha 2 receptor is inhibitory receptor. So inhibitory receptor giving negative feedback system, GI protein, block all those enzymes. Hydroxylase, decarboxylase, clear? Another hydroxylase. So all the enzyme stop. Norepinephrine production decrease. Norepinephrine release decrease. So norepinephrine release decrease, say blood vessel here, smooth muscle, blood vessel, alpha 1 receptor there. So norepinephrine release decrease, yeah. So what happened? Vasoconstriction? No. Because norepinephrine not there, yeah. So another receptor on the another receptor present beta 2. Beta 2 causing what? Vasodilation. Clear? So no vasoconstriction. It lead to decreased blood pressure, not increased blood pressure. Understand? So clonidine and methyl dopa we use for hypertension, not for hypotension. Understand? Use for hypotension, not for hypertension. Clonidine for emergency hypertension, alpha methyl dopa hypertension in pregnancy. What are the side effects of alpha methyl dopa? Autoimmune hemolytic anemia. Clear? Autoimmune SLE, autoimmune hemolytic anemia. Another special thing, this drug not only act on peripheral system, it's act on and also going inside the brain and stop the sympathetic system inside the brain. That's why this is the reason why we prefer in pregnancy. It not affect the fetal life. Okay, it not have no interaction with the fetal tissue. Understand? So very safe in pregnancy. Alpha methyl dopa. Alpha methyl dopa is a drug of choice for pregnancy induced hypertension, or if any pregnant lady already having hypertension then pregnancy. So in case of pregnancy, to control blood pressure, we prefer alpha methyl dopa. Understand? Okay, another question I ask from you, this answer must give. Okay, what is the interact if patient having hypertension, you want to decrease blood pressure, I give alpha methyl dopa or clonidine, yeah. Patient also having diabetes, what happened with this patient? How about the glucose level? If you remember alpha 2 function, another function, decrease release of insulin. Understand? Decrease release of insulin. Oh, if you decrease, already patient, diabetic patient already have no insulin or insulin not working good, yeah. So what happened? Another side effect of these two drugs, they causing what? They causing a hyperglycemia. Understand? Why? because they decrease the release of insulin. If you stimulate alpha 2 receptor present on beta cell, done. Alpha 2 receptor present on beta cell. Which protein? GI protein. Inhibitory protein. Production of insulin stop. Release of insulin decrease. Yeah, because inhibitory receptor. So what happened? No insulin. Patient diabetic. I'm not using this clonidine methyl dopa in diabetic patient also having hypertension. Clear? Because they interfere with the sugar level, blood sugar level again going high, hyperglycemia. It's not good for use in hypertension if patient also having diabetes. Interact with the diabetes. Yeah, done. So what is the effect of clonidine and methyl dopa on blood sugar level? Effect of alpha 2 agonist on BSR. It's a basal sugar rate, okay? Blood sugar, random sugar. Done? So what effect on sugar level?
Increase.
Increase. Good for diabetes?
No.
Yeah. So causing hyperglycemia. Understand? So this side effect also keep in mind. Alpha 2 drugs, alpha 2 agonists were used for emergency hypertension. We also prefer for pregnancy induced hypertension. Alpha methyl dopa. Done. Sometimes very important question about alpha methyl dopa side effect. SLE, alpha methyl dopa side effect autoimmune hemolytic anemia. Clear? Alpha methyl dopa only centrally acting drug. Centrally acting also work in brain. Understand? Decrease sympathetic activity inside the brain. Decrease sympathetic activity inside the brain. These two drugs, alpha 2 agonists, we use for hypertension, not for hypotension. Done? Alpha 1, alpha 2 clear.
Sir.
Alpha 1 and alpha 2. Just now we done alpha 1 drug and alpha 2 drug. These two drugs, for example, here phenylphrine and oxymetazoline, yeah, they prefer alpha 1. And this side, clonidine and alpha methyl dopa, they prefer what? Alpha 2. So what name you give to these drugs? These are the selective, yeah. These are the selective alpha 1 agonists, understand? They directly go for alpha 1 only. They attach with alpha 2? No. Clear or not? They have no interaction with alpha 2. Clonidine, alpha methyl dopa have no interaction with alpha 1. So they are selective for alpha 1 and alpha 2. So these are selective alpha 1, alpha agonist. Understand? Selective alpha agonist. Name clear or not? These are selective or these are direct acting. Why direct? What means direct acting? They directly act on a receptor. Because they directly act on a receptor, yeah? Selective alpha agonist. Selective for alpha 1, selective for alpha 2. Yeah? Okay, now come to non-selective. Non-selective alpha agonist. Tell me one name. Non-selective alpha. Non-selective alpha agonist. Norepinephrine. Norepinephrine also go for alpha 1 and also go for alpha 2. Understand? Norepinephrine also attached with alpha 1, also attached with alpha 2. Both receptors clear. Norepinephrine prefer both receptor alpha 1 and alpha 2. Norepinephrine prefer both receptor alpha 1 and alpha 2. Done? Alpha 1 and alpha 2. Norepinephrine. So norepinephrine causing what? Vaso, with the help of alpha 1, they're causing vasoconstriction. Yeah, they're causing vasoconstriction. So they're increasing blood pressure. So they're increasing blood pressure. So we can use in case of shock patient. Which shock would prefer which drug? Epinephrine we also use in shock. Dopamine we also use in shock. Dobutamine we also use in shock. Norepinephrine we also use in shock. Phenoldopham we also use in a lot of drug in shock. Because shock have different categories. Yeah? The pathology of the shock. What is the shock? Blood pressure going down. All body organs affected, okay? All body organs. In the shock stage, patient in shock stage, patient in hypotension, yeah? So at what time we use which drug? Norepinephrine causing alpha 1 receptor stimulation, yeah? This we know. Vasoconstriction. Causing what? Vasoconstriction. So if any shock having vasodilation, the shock due to, now tell me name of shock having vasodilation.
Septic shock.
Septic shock, very good. Septic shock, the problem that bacterial toxin causing vasodilation, yeah? Septic shock, vasodilation. Neurogenic shock, neurogenic shock, vasodilation. Clear? Neurogenic shock also vessel dilated. No release of norepinephrine in neurogenic shock. So patient having sudden injury of spinal cord and sudden sympathetic activity stop, patient now in shock, that's known as neurogenic shock, okay? Septic shock. Septic shock because of infection, yeah? Septic shock. Neurogenic shock. Another shock, vasodilation shock, anaphylactic shock. Anaphylaxis, you know, allergy. Anaphylaxis. Anaphylactic shock due to histamine. Okay. We have three shock. Three shock. They have problem with vasodilation. Okay. Norepinephrine we can use for septic shock. We also can use for neurogenic shock, but we not use for anaphylactic shock. Anaphylactic shock, a drug of choice is adrenaline, epinephrine, not norepinephrine. Okay, let me explain this. Okay, the only two shock stage, septic shock and neurogenic shock. Okay, septic shock and neurogenic shock, the patient having the issue vasodilation. Vasodilation in septic shock and neurogenic shock. Norepinephrine stimulate alpha 1 receptor. Clear? Norepinephrine stimulate alpha 1 receptor and change this vasodilation to vasoconstriction. Understand? Change this vasodilation to vasoconstriction. Done. So now no more vasodilation. The vasodilation resistance decrease. But the blood pressure equation, cardiac output multiplied by resistance. Yeah, it's a question for blood pressure. So if you decrease the resistance, blood pressure low. If you increase the resistance, blood pressure high. Done. When vasodilatory shock, in vasodilation, it's also known as distributive shock. Distributive shock, vasodilators are same thing. Okay. So vasodilation, resistance decreases. Okay, in case of septic shock, drug of choice for septic shock, norepinephrine. Drug of choice for septic shock, norepinephrine. Done. Drug used for, also can use for neurogenic shock, norepinephrine. Understand? In neurogenic shock, in septic shock, we can use norepinephrine. So one use of norepinephrine, non-selective alpha blocker, norepinephrine, used for shock patient. Clear? Which shock? The first use shock. Septic and neurogenic shock. Septic and neurogenic shock. If patient just having a mild decreased blood pressure, yeah, still you can use for hypotension. Patient not in shock, patient a bit conscious. Use for hypotension. Use for hypotension. Use for shock. Number third use, norepinephrine, noradrenaline we use with local anesthesia. Local anesthetic. Local anesthetic. If you have any wound on your skin, you need stitching. So before stitch apply, we need give local anesthesia to make the all the nerve endings stop working. Yeah, so that so patient not feeling much pain. Understand? So it's known as local anesthesia. The local anesthetic, these drugs are sodium blockers. Local anesthesia, the injection, the injectable we use inside the skin. Okay, never use IV. Okay, understand? Only use under the skin, subcutaneous, subcutaneous. Okay, so why we add this local anesthetic agent? For example, the name lignocaine is a trade name. I write a real name.
We started.
Lidocaine. Okay, restart.